Hello, this is REVOXYLIFE with Dr. Sophia Edwards-Bennett, aka Dr. EP. Welcome. As you can see, I'm at work in my office, but I had a short break, so I decided to honor my promise to you to discuss the role of radiation therapy in the care of cancer. Now, I also mentioned that I would explain to you what exactly radiation therapy is, what it entails, and how is it actually administered. But first, let me define a few terms. The word oncology means the study of cancer. And so when you see oncology, it really just refers to cancer. Now, there is medical oncology and there is radiation oncology. As you know, I am a practicing radiation oncologist. In medical oncology, chemotherapy is used to treat cancer. So the patient is either given a pill, which is taken by mouth, or more commonly, chemotherapy is administered through the veins, which means that it is diffusely distributed throughout the body, so it is systemic. Radiation therapy, on the other hand, is more focal. So it is only directed to the site of disease. So if the cancer is in the lung, then the radiation is directed to the actual lung mass. If disease is in the breast, then the radiation is directed to the breast. If the cancer presents in the prostate, then of course, yes, you got it. Radiation is directed to the prostate and the prostate only. Now, what exactly is radiation? Because most patients and the general populace, they're familiar with chemotherapy, at least they've heard of it, but radiation is almost like a black box. And that's mostly because it's its own specialty. So when you are in medical school, you really don't learn much or at all about radiation, unless, of course, you plan to specialize. And then, of course, you have to take an elective. But generally speaking, no, you do not learn about radiation therapy in medical school. So it requires specialization post completion of medical school. Now, again, let's focus on the question, what is radiation? Now, you've been to the dentist at least once, maybe, or you've been to the ER. You've had an x-ray. So let's use the dental office as an example, without the pain, of course. Now, when you go to the dentist with complaint of a toothache, the first examination after, of course, examining your oral cavity or your mouth, then they'll recommend an x-ray. The x-ray then determines exactly where the pain is coming from, the etiology of the pain, the source of the pain. And then they decide if you need to fill a cavity or you need a root canal. So the x-ray gives them detailed information regarding the source of the pain and what needs to be done to alleviate the pain. So if you've had an x-ray, you know what radiation is, because radiation is actually high energy x-ray. That is what radiation is. And because it's high energy x-ray, it can ablate or kill cancer cells. So that is what I do. I use radiation therapy to ablate or kill cancer cells. And this is really what I explain to my patients. So whenever I explain what radiation therapy is in this manner, it allays my patients' anxiety, because anxiety is really induced mostly by the fear of the unknown, and they're already diagnosed with cancer, so they're already scared. And so just explaining in simple terms what radiation is in a manner that is familiar to them, it really alleviates some of the anxiety. And so now you know what radiation is. And so if you have a friend or a colleague or a neighbor who informs you that they've been diagnosed with cancer, and they may say, I'm told that I need chemotherapy, and that's fine. I know what chemotherapy is, but they've also told me that I need radiation, and I'm really not sure what that is. And so, of course, I'm scared. And then you will respond by stating that, well, I watched a video with Dr. EB, and she explained to me that it's really just high energy x-rays. And so before the patient actually shows up or presents for their consultation, they will feel just a little bit more relaxed because, of course, they're more informed. And as I said, fear of the unknown triggers anxiety. And so you can help to allay that. Now, I use the analogy of the dental office and x-rays, but I do not want you to be misled, because radiation therapy, when it's actually being delivered, is actually painless. So the patient is placed on the table and is immobilized, meaning that they're placed in a customized mold, tailor-fitted to the area where the disease presented. So for example, if it's a lung cancer then, or a breast cancer, then there is a mold or a custom-made material that is fitted to the chest so that they're stabilized, so that they don't move during the treatment, okay? Now, once that's done, then of course we verify that the patient is in the correct position based on a complicated algorithm that I will not discuss today. But it is important to note that it is indeed essential that the patient's position is accurate, because then we know that the radiation is being delivered precisely as planned, because of course we do have to go through a myriad of steps before the patient is actually treated, and all these steps are meticulously executed. So what happens when the patient's on the table? Once they are placed in the right position, and this is actually verified to be extremely accurate, then the treatment begins. And the machine rotates around the patient, delivers the radiation. The patient feels nothing, again, painless. They'll hear a funny sound just like an x-ray, but they don't feel anything. And again, that's what I explain to my patients when they see me. Now here is the vivid display that I described earlier. You'll see in a minute. So I know it looks quite intimidating. I'm aware of that. And so sometimes when I see patients in consultation, I can tell that even with the explanation of the similarity of radiation to, say, an X-ray, even though this is high energy X-rays, basically, in simple terms, they still harbor some fear. And so I will, during consultation, before the treatment, just give them a chance to at least glance at the machine so they can at least have a mental picture. And I think that usually helps. And that is the gantry, what we call the radiation head, the head of the radiation machine. And that's actually what rotates around the patient when the patient is being treated. Okay. Again, Fear of the unknown is what induces anxiety, which means that knowledge is half the battle, maybe not half, maybe a quarter or 1/8, but it at least alleviates fear. So what you're seeing there is the machine that we use to treat this radiation, and it's called a linear accelerator. We shorten that term. We usually say LINAC. Okay, and then surprise, that's me. That's EB on the treatment machine. So this is where the patient would be placed. And of course, you would not be able to wear your glasses. This is obviously a simulation just to demonstrate. So now you have an idea of what occurs in the radiation treatment room. And that's it, guys. I hope that this was quite helpful for you. Okay, guys, back in my office, I am going to end this video, but I really hope that this video has at least clarified what radiation is, certainly what I do, and therefore you can impart this knowledge to those who you may encounter who need to be edified, and of course allay their fears as well. Thank you for watching. This has been REVOXYLIFE with Dr. EB. Have a wonderful day.